We have expert advice on what every patient should know before going under.
When considering surgery, you probably ask the obvious questions like, how long of a recovery? But do you ever think about one of the most important aspects, going under? Anesthesiologist Dr. Barry Friedberg is here with some things you really should know. Dr. Friedberg, it's good to see you. Especially, I think we're in an era where a lot of people, and Kylie Ray Torres, I should mention, is our model today, who's actually hooked up. We'll get to you in just a second. But a lot of people, obviously, they have necessary surgeries as they must get done. But then a lot of people opt for cosmetic type surgeries, and they don't really think about, well, the whole anesthesia part. They just assume somebody like you is going to be there and do what they need to do. But you said there's a lot of questions we should ask.
Yes. First of all, you want to be sure to do your homework to find out exactly who is giving your anesthesia. If you're in an accredited hospital, a surgery center, or an office, those details will have been taken care of, but you certainly want to find out if the office is accredited. In Arizona, I'm not sure what the law is about office accreditation. Once you find out who's going to give your anesthesia, you want to be sure you have an interview.
Really?
Yes. You want to talk to your anesthesiologist, not when you're lying on the gurney.
Well, usually you meet them right before they go, shh.
Right. Not when you're lying on the gurney ready to go down the hall, but before you go to that facility. And the most important question you want to ask is, will I have a brain monitor for my anesthesia?
Well, I know for a fact I didn't have a brain monitor when I was having my kids. Why is that so important? Now, Kylie Ray, you have one on your head. Why is a brain monitor?
That's the sensor. The sensor connects to this computer, and you can see her live display here. Well, it's a very simple thing. The drugs we give in anesthesia affect your brain, and since 1996, we've had the ability to directly measure. What you see behind you there on the counter is the typical vital signs that we've been measuring since 1984. Okay. That's the electrocardiogram, the automated blood pressure, and the oxygen sensor on her fingertip. Shh, it's okay.
What did I do? Okay.
At any rate, those tell you everything you need to know about this young lady from her neck down. And you cannot get the information about her brain from that bits of information. You can only get it directly this way.
What are some of the things that anesthesia could do to your brain then? What are some of the things?
Well, the problem is if you can't contact the patient because they're asleep, we're obliged to give too much anesthesia for fear of giving too little, all right? And the net effect, especially if you're over 50, and understand in Arizona we have a few people who are over 50, your brain is much more sensitive to the negative effects and the negative risks of anesthesia, which are delirium, dementia, and death.
Permanent dementia, permanent delirium.
Can actually trigger an Alzheimer's-like dementia.
Wow.
And basically what I like to say is that you want to be sure that you wake up with the same number of marbles that you started with.
Absolutely, but right, Kylie Ray? So what are some of the myths that you think that folks think about anesthesia?
Well, anesthesiologists are trapped in the 20th century by and large, most of them. 60% of the hospitals in the United States have this device. They're only being used 20% of the time. And the reason is they're trapped in this belief that those vital signs are a clue to what's going on in her brain. It's complete nonsense. This is the only way you will learn. And the issue of over-medication is the massive public issue, and unfortunately the press likes to titillate and terrorize the public by talking about the 0.1%, as you can see on the graphic, of patients who are awake under anesthesia.
Very rare.
Very rare, and 80% of those problems are solved by the use of a brain monitor. But the really pressing issue is the avoidance of routine over-medication.
Wow. Have you ever been put under, Kylie Ray? No, I'm asking a personal question.
I've never even had surgery.
But it's interesting. I don't think most people would think to say, I'd like to meet my anesthesiologist ahead of time. I want to interview him. And what's the response we're going to get when we go to that person and say, are you using a brain monitor? How many of them are going to go, no?
Well,
and then what do we do? Find the guy that does use the brain monitor?
Precisely. That is the message of the nonprofit foundation that I started, the Goldilocks Anesthesia Foundation, because you don't want too much and you don't want too little. You want it just right. And the only way it's just right is by directly measuring what you're doing.
And you're talking all kind of surgeries?
Yes,
because, I mean, pregnancy, you get...
well, we're not talking about childbirth because they're not putting you to sleep for that.
So you have to, the ones that you're getting totally put under.
Precisely. There are major and minor surgeries, but every time you're being put under, it's a major risk to your brain, and the older you are, the more the risk is. So it's critical. It's absolutely critical that nobody has anesthesia like this without a brain monitor.
Wow. What about for people, cosmetic surgery is so big nowadays, especially here in Arizona, LA, influence, and so forth. Are we putting ourselves under unnecessary risk by getting cosmetic surgery that we have to go under for?
Only if you don't have a brain monitor.
Only if you don't have a brain monitor. So
yes.
really? get
My
the brain monitor.
textbook actually came out 3 years ago, Anesthesia and Cosmetic Surgery.
Yeah.
And it's the first anesthesia textbook with a brain monitor on the cover, and the first anesthesia textbook to discuss levels of anesthesia with numbers that anybody across the country can talk about rather than words, which can have different meanings depending on how people are using them.
Are we going to have a hard time finding anesthesiologists that use this?
Not really.
Okay.
Like I say,
it's becoming more common.
There are more of them out there, but the proposition you're putting to them, even though you're asking if a brain, it's an all or none proposition. It's the same deal that got fathers in the delivery rooms for the birth of their children. It's okay. If you don't want to do that, we'll go down the street where it is done. And trust me, the cost of the $20 sensor that the hospital can't recover will be a negligible issue compared to the cost of losing your surgery.
That's a good question, too. So it doesn't really cost that much extra to have that done?
No, it's a trivial cost compared to the value of your brain. Most people think their brain is worth more than $20.
Okay, very interesting. Thanks, Dr. Friedberg. So now you need how's she doing, by the way? Her vitals look pretty good,
Her
huh?
vitals look good, and because she's getting nothing to depress her brain, 98 to 100 is awake. So we can not only see that she's
You're awake.
but the question becomes to the anesthesiologist, once she loses consciousness,
Yeah.
can no longer talk to us, how asleep is she? Yes.
Yeah, I've had my children, unfortunately, tonsils and so forth. Very important, obviously, with kids. You said as you get older, over the age of 50, becomes more crucial. What about with children?
It's always important for any time a patient is put to sleep to have a brain monitor so that they get exactly as much medicine they need, not too much and not too little.
Gotcha, the Goldilocks theory there. Thanks, doctor. Just to recap real quick, too, if you're getting surgery, these are the 3 things you really should ask. Who is your anesthesiologist? Actually meet them, interview them before they put the thing right over your face.
Yes.
Try to meet them ahead of time, and then always ask for a brain monitor.
Right, you may only be able to contact them by phone or by email,
Right.
but you want to have that contact, and you want to be sure, as I was 2 years ago when I had my hip replaced, there was no way that they were going to give me drugs for my brain without a brain monitor.
Great. Thank you very much, Dr. Friedberg. Good
You're sure
information.
welcome.
Thank you, Carly Ray, for being such a great
Absolutely.
model today. Remember, not too much, not too little, just right. Thanks
There's a
again.
book coming out, too, called Getting Over Going Under. It should be out this summer. It's 5 things you must know before anesthesia, and we'll be able to talk about that at a later date.
All right, thanks again. All right, and once again, if you want more information, of course, you can find it on our website at azfamily.com/yourlife or dial our hotline.